They're being called the anti-aging miracle. Small pellets implanted under your skin that promise to balance your hormones, bring back your energy, boost your sex drive, and even turn back the clock on aging. It sounds almost too good to be true, and that's the problem. Today, we're diving into the hormone pellet craze. What they are, the promises being made, and most importantly, what the science actually says. Stay with us until the end, because we'll also cover safe, evidence-based ways to support your hormone health. So what exactly are hormone pellets? Hormone pellets are tiny implants about the size of a grain of rice. A doctor inserts them under the skin, usually in the hip or buttock area. The pellets slowly release hormones, typically testosterone, estrogen, or a combination, over several months. The idea is convenience. Instead of taking daily pills or using creams or patches, you get a steady release of hormones for 3 to 6 months at a time. Here's where things get flashy. If you visit a clinic's website or sit through one of their seminars, hormone pellets are often presented as the ultimate fix-all. The marketing is designed to speak directly to the frustrations many people face as they age. Low energy and fatigue? They'll tell you pellets will have you waking up refreshed, ready to power through your day like you're 25 again. Brain fog and memory loss? Ads suggest pellets can sharpen your thinking, restore focus, and keep your memory clear, almost like flipping a mental on switch. Low libido or sexual dysfunction? Pellets are often pitched as a way to reignite your libido and bring back the passion in your relationships, sometimes marketed as a marriage saver. Weight gain or belly fat? You'll hear claims that pellets can melt away stubborn fat, boost your metabolism, and even help you build lean muscle without changing your diet or exercise. Mood swings, irritability, and depression? Some clinics go as far as promising emotional stability and happiness, suggesting that pellets can rebalance your mood better than traditional therapies. And of course, the big one, anti-aging. Pellets are marketed as a way to turn back the clock, making you look and feel years younger. With glowing skin, thicker hair, and newfound vitality, the message is clear. If you feel tired, moody, forgetful, or frustrated with your body, pellets are positioned as the magic solution. It's powerful marketing because it plays on very real struggles that come with aging. And that's exactly why it's important to separate the promises from the actual evidence. If you Google hormone pellets, you'll see before and after stories that sound like magic. But are these claims backed by science? The truth is, research on hormone pellets is limited. For men, testosterone replacement can help men with clinically low testosterone, improve energy, mood, and muscle mass. But the pellet method hasn't been shown to be more effective than gels, patches, or injections. For women, some studies suggest hormone therapy can help with hot flashes, vaginal dryness, and bone health after menopause. But again, pellets don't have unique advantages compared to other forms of hormone therapy. In fact, the FDA has not approved hormone pellets for men or women. That means there's less oversight on safety, consistency, and long-term risks compared to other hormone therapies. Now, here's the part that rarely makes it into glossy brochures or upbeat clinic presentations: the risks. Overdosing or underdosing. With pills, patches, or creams, your doctor can adjust your dosage if you're not tolerating it well. But with pellets, once they're in, they're in. If you get too much hormone, you can't dial it back. You just have to ride it out until the pellet dissolves months later. That means weeks or months of acne breakouts, mood swings, or even dangerous health changes you can't reverse quickly. Everyday side effects. Some patients report oily skin, sudden hair growth in unexpected places, water retention, or breast tenderness. These might not sound life-threatening, but when they're constant for 6 months, they can be miserable. Serious long-term risks. Studies on hormone therapy show possible links between high hormone levels and conditions like blood clots, stroke, heart disease, and hormone-sensitive cancers such as breast or prostate cancer. The science isn't black and white, but the concern is strong enough that major medical organizations recommend the lowest effective dose for the shortest necessary time. With pellets, you can't always control that. Procedure risks. Remember, pellets are inserted under the skin with a minor surgical cut. That means there's always a chance of infection, bleeding, or scarring at the implant site. And because the pellets stay under your skin, sometimes they can migrate, come out on their own, or form small lumps that require another procedure to fix. What makes all this more concerning is the lack of oversight. Pellets aren't FDA approved, and dosing isn't standardized. One clinic's pellets might not be the same strength or quality as another's. That leaves patients in a gray area of buyer beware. In short, while pellets can work for some, the risks are often downplayed. And once you commit, you don't have much control if things don't go as planned. While it's true that some patients do feel better on pellets, but that doesn't mean it's the safest or most effective option. So why are hormone pellets exploding in popularity? A big reason is marketing. Many wellness centers and cash-based clinics push pellet therapy because it's profitable. Once you get pellets, you have to come back every few months to replace them. That creates a recurring revenue stream for providers. And unlike FDA-approved treatments, pellet therapy often gets branded as bioidentical, natural, or safer. But in reality, bioidentical just means the hormone's chemical structure matches what your body makes. It doesn't guarantee safety or effectiveness. So this begs the question, are these pellets ever useful? Let's be balanced here. Pellets aren't pure snake oil. Some patients do report improved quality of life. A few studies suggest pellets may deliver steady hormone levels compared to daily pills or creams. For people who don't want the hassle of daily treatment, pellets can be convenient. But again, no evidence shows they're better than other, more studied hormone therapies, and the risks often outweigh the convenience. So where does that leave us now? If you're struggling with low energy, hot flashes, or other hormone-related symptoms, here are options backed by stronger science. FDA-approved hormone therapy. Pills, patches, creams, or gels for estrogen or testosterone. These can be adjusted, paused, or discontinued if side effects occur. Lifestyle strategies. Regular exercise, strength training, sleep, and nutrition can support hormone balance naturally. Targeted treatments. Sometimes, symptoms like fatigue or low libido may be linked to sleep apnea, thyroid issues, or mental health, not just hormone levels. Treating the root cause can make a bigger difference. The key? Work with a qualified healthcare provider who looks at the whole picture, not just a single lab number or symptom. What's the bottom line here? The hormone pellet craze is built on a seductive promise. Effortless, long-lasting hormone balance that makes you feel young again. But here's the reality. There's no solid evidence pellets are superior to other hormone therapies. The risks are real, especially with adjustable dosing and lack of FDA approval. If you're considering hormone therapy, start with proven, flexible options and discuss them with a trusted healthcare professional. Your health deserves more than hype, so do your research before committing and ask your doctor the right questions. If you found this breakdown helpful, hit that subscribe button and join us here at Modern Wellness Lab. We cut through the wellness noise with real science, so you can make informed choices about your life. And let us know in the comments, have you heard of hormone pellets or do you know someone who's tried them? Your stories help shape our future videos. And remember, this video is for informational purposes only, and it's not medical advice. Always consult a qualified healthcare professional before making decisions about your health, diagnosis, or treatment.